To deliver his talk on the business of inclusion, ESG's role in social equity, let us welcome Mr. Saravanan Desigamanie, Head of Group Sustainability at KPJ Healthcare Berhad. Please welcome.
Good afternoon, ladies and gentlemen. I know it's towards the later part of the evening, so I'll try to make sure that I don't end up, making you sleep. So because this is a very straightforward topic, because every time we talk about ESG, it's about the environment. Very rarely we talk about the social and governance aspects of it. So as the head of sustainability of KPJ Healthcare, which is the largest network of private hospitals in Malaysia, I've had the opportunity to see how we are able to embed the social part of things into sustainability. So I'd really love to share that with all of you today. So, ladies and gentlemen, the thing is, we are living in a world where ESG is no longer optional. So last year, over 90% of institutional investors globally considered ESG risks in their decision making. But here's the catch. While environmental data dominated the headlines, it's the social risk that can erode value just as quickly, if not faster. Labor disputes, healthcare inequities, lack of community trust. These are not just ethical issues, but they're strategic ones. And in healthcare, the industry where I'm basically operating in, they sit right at the heart of the sustainability agenda. Now, social sustainability isn't just a line item in a report. It's a matter of access, equity, and accountability. So today, I want to share with you how we've turned the S in ESG into a strategic lever for impact, resilience, and trust. Now, just to share with you a very personal journey, because I come from the plantation industry previously, and then I moved to the power sector. So the plantation industry, the most controversial issue was deforestation, clearing lands to plant oil palm. When I moved to the power sector, it was all about decarbonization, coal plants, running coal plants to generate electricity for the country. So both were very controversial sectors. Then I came to healthcare, KPJ Healthcare. So I thought, KPJ Healthcare is non-controversial. It's about saving lives. The social impact of it is very high. But you'll be surprised, there's so many ESG issues in healthcare because hospitals use electricity 24/7. So there is high intensity of electricity usage. There is high intensity of raw water consumption. And how do we manage clinical waste in hospitals? So, although I moved away from the controversial sectors, coming into healthcare really taught me a lot of the E part of ESG. But again, here is where the myth is. The understanding or the conception, the misconception is that when it comes to the social part of things, you're already in healthcare, right? So when it comes to the recent pandemic cases, the recent pandemic that we had to weather, when it comes to COVID-19, or even any health-related issues, it's not so much about just being at the forefront of managing all these critical challenges. But the fact is, a lot of the areas within the social part needs to be managed strategically, even for a healthcare organization like KPJ Healthcare. And here is where it's a bit unique. When you talk about social element, a lot of companies, the first thing that comes to mind is, how do you, let me just get a slide in. Okay. How do you manage the productivity of your staff? How do you keep them engaged? How do you ensure there is zero incidents at your workplace? There are no fatalities, no injuries, and so on, right? They call it zero LTIs. And then you also talk, when you talk about social element, we also talk about CSR activities. We talk about community engagement. We talk about mental health. We talk about keeping our workforce engaged in order to increase productivity. So for a lot of companies, typically that is the social element of ESG. But in healthcare, there's an additional element, which is the delivery of healthcare to patients. Zero sentinel cases. How do we deliver quality healthcare to the populations which might not be receiving the kind of healthcare quality services in the urban areas? How do we go to the underserved populations, the underserved areas, to ensure that there is healthcare access for them? So this is something that is very, very, very interesting, because traditionally ESG discussions center around carbon emissions, energy, waste. But as I mentioned, we are slowly seeing it pivoting towards S. Now, this just isn't a trend, right? We have to understand that the social equity part is very real, and it's to address pressing issues such as health access disparities between urban and rural communities, aging population, the fact that there is a need for integrated care, gender gaps in the workforce. That is why whether it's Bursa listed, the requirement by Bursa for listed companies, or even for private companies for that matter, there is always this encouragement to have 30% of your leadership to be women, for example, or even your workforce. So this is again promoting gender equality, especially in leadership. And there's also low health literacy and digital divides in underserved segments. Everyone is talking about AI today, but do our friends or communities in the rural areas understand how to use AI effectively? So these are the kind of disparities that we see when it comes to the social equity issue. Now, what's more important is, as we address this whole social element, it's important to understand, why do companies need to look at social equity? Now, a 2020 study by McKinsey showed that companies in the top quartile for gender diversity on executive teams were 25% more likely to have above average profitability. BCG, or Boston Consulting Group, found that companies with more diverse management teams earned 19% higher revenue from innovation. So, ladies and gentlemen, equity drives innovation, inclusion drives impact, and most importantly, diversity drives growth. So, when you talk about climate and health issues, it's quite interesting to see that, when it comes to environmental problems, it's not just extreme weather events or poor air quality or rising disease burdens that we are handling. We are looking at a higher strain on health systems. We are seeing rising chronic illnesses, increasing health expenditure, and greater inequality in health outcomes. So what do? In our case, to share KPJ's experience, we invest in sustainable healthcare, green healthcare. And this is not just for environmental returns, but it's also for human resilience. Now, if you look at KPJ's green healthcare network, framework, as we call it, we anchor our sustainability efforts in 5 key pillars. Patients, who are the heart of everything that we do. People, our employees, the backbone of care delivery. And this is a very crucial element of the social part of ESG. Physicians. In KPJ Healthcare, physicians, they are not our employees, they are our partners, right? So they are the ones who are driving innovation and clinical excellence. And the partners, when you talk about partners, these are the insurance providers and so on. And we have to collaborate with them through the ecosystem. And finally, planet. How do we manage our environmental footprint? Because today, when it comes to the healthcare industry, one of the most pressing issues is the rising medical cost, medical inflation. So when it comes to the role of KPJ Healthcare, for example, in the social aspect, it's not just about carrying out CSR activities, but how do we strategically carry out our initiatives in order to ensure that the underserved populations and areas, as I mentioned earlier, get the kind of quality healthcare delivery. Now, for KPJ, we have 17,000 employees across 43 operations. So, how do we embed ESG within our operations? We're talking about energy efficiency, renewable energy. We are looking or exploring installation of rooftop solar at our hospitals. In fact, I think all of you would have read the news. Just yesterday, the government came up with new electricity tariff structure, which is going to be effective 1st July onwards. So there are a lot of different changes to the regulation on how our electricity bill is going to be calculated. So for hospital industry, the healthcare industry, where we have very high intensity of electricity usage, so you just imagine how much the revised tariff will impact us, because there is going to be an increase of 14% in the base tariff. The reduction that you see in the news headlines, the 19% reduction, is for domestic users, those who have electricity below 1,000 kilowatts per hour, for example. And here is where it's important for us to explore energy efficiency. So when you talk about energy efficiency, together with health literacy, this is the kind of awareness that we want to ensure that all our communities are well aware of. So it's not just about the environment part, they also need to understand the social impact of not just the healthcare, but the impending regulations that are coming along. Now, waste and water management. So this also goes back to the environmental element of it. Diversity and inclusion is how we are able to ensure inclusiveness in not just our workforce, but also in the healthcare industry, the patients that we serve. Because one of the key elements of the healthcare industry among patients is also health tourism. You see a lot of patients coming in from Indonesia, from Singapore. They don't just go to Thailand, they're also coming to Malaysia, whether it's in Penang, Klang Valley or Johor. So there's a huge market for health tourism. So how is this related to social equity? Because our people, our workforce, our nurses, our doctors, they need to be sensitive to the cultural and the demographics. They need to understand the difference in having all these different cultural demographics among the patients in order to ensure that we are able to give the best healthcare delivery. And of course, all this will be meaningless if we do not have transparent governance and also, obviously, zero corruption. So the important thing is these are all not isolated projects. They are embedded in our operating model. Now, just want to share with you, how do we treat this social equity part in KPJ Healthcare? So as you can see there, when it comes to E, S, and G, the environment part talks about renewable energy, energy efficiency, and so on. And governance, of course, we're talking about green procurement, we're talking about risk management and transparency. Now, if you look at the social aspect, I mentioned about diversity and inclusion, patient care. Now, what we are trying to do differently in Malaysia when it comes to patient care is to have the KPJ health system. And especially to the academicians here, you'll be very familiar with the Mayo Clinic's business model. So similarly, KPJ Healthcare is trying to have clinical, research and education embedded together to improve our healthcare delivery to not just our patients, but also the rural communities. So here is an opportunity for us to integrate all this within patient care. Now, employee well-being, health and safety, it goes without saying. Like I mentioned earlier, right? It's not just about HSSE, it's not just about zero incidents, but ensuring that your workforce is engaged. You need to measure this, and that's something I'll also share later. Because there's no point talking about all these social elements if you don't have effective metrics to measure. So always remember, there is nothing better than having the best kind of delivery to your customers, or in our case, patients, if you don't take care of your own people. So that's something that's very important. And community engagement. So CSR is not something new. All companies have been doing CSR for ages, but it is a business imperative today because by carrying out CSR activities, you're improving the socio-economic conditions of the communities where your businesses operate in. And that would, in return, improve the productivity of your business and your workforce. So it's not today CSR is no longer something that you just do for your local communities, but it's also a strategic imperative for businesses. So at the end of the day, you need to reach out to the people and to the communities around you, because it's not just enhancing their living conditions, but it's also to ensure that they get access to the kind of businesses that you're involved in. And in our case, it's healthcare delivery. Now, I just want to show you again, earlier what you saw was the overall framework. Now, if I take a step further to deep dive into my ESG, I'm already sharing with you the ENG, which is not so much the topic for today, but look at the social part of things. When you talk about diversity, when you talk about an inclusive workplace, basically what we're talking about, having equal opportunities, having inclusive policies. Now, a lot of companies, obviously, they don't have discriminative policies, but do they have HR charters? Do they have actual policies that spell out how do these companies commit to inclusiveness? And when it comes to patient care, the health system that we have been exploring is something where we are collaborating with Mayo Clinic from the US. So this gives an opportunity for KPJ healthcare workforce to think innovatively from a healthcare perspective in order to improve the patient delivery or healthcare services. Now your next question will be, how do you guys do it? When you talk about innovation, how is it that a company or healthcare organization like KPJ can introduce new innovation to help all of us as patients? I'll give you an example. We're not just talking about minimizing single-use plastics in hospitals. Today, when you go to hospitals, you don't get your medication in plastic anymore, because all of the hospitals have eliminated single-use plastic. You either get paper bags or biodegradable types of plastics. But more importantly, in the clinical procedures, I'm not sure if you're familiar with this term called Green OT protocol. So Green Operating Theatre Protocol would be initiatives that hospitals can carry out within the operating theatre. For example, the kind of gases that's used for anesthesia, right? It is also giving out very high emissions, and also the kind of equipment that's used in the OT itself. So all this on top of the facilities in the hospitals. Today, when you talk about green certification for hospitals, it's a combination of implementing energy efficiency within the hospitals and also ensuring that these hospitals would be able to weather extreme events. And you don't have to look at Europe or Australia or even China and India for extreme weather events. Even in Malaysia, whenever there is huge, where there is what you call prolonged rain and there are floods in Kelantan, we have a hospital in Kelantan, and we are not able to operate as normal because of extreme weather events like this. So how do we build our hospitals with those green elements? Because sometimes when people talk about green hospitals, green buildings, they think a lot of green plants. It has to be green everywhere. That's not the case. Even hospitals, the way we build it, having high ceilings, having proper lighting, scientifically has proven to improve patient recovery. And the best part is, and this is something that I know a lot of the speakers earlier spoke about, how ESG improves your revenue or improves value. We do not want, from a corporate perspective, every time we talk about ESG, every time we talk about sustainability, there needs to be a value to it. It's not about increasing your cost. It's about cost optimization. So that is why when you get green building certification, we're talking about energy efficient initiatives which reduces your electricity bills. So your energy consumption goes down, your emissions would go down, and this is also something that a lot of our patients are looking for. You'll be surprised to see that there is a niche group of patients, right, who are willing to pay a premium for green services. When you get admitted in the hospitals, your admission kit, it comes with your shampoo and body wash, whether it's ethically produced, what kind of material or substance that goes in. So all these different things, there is a niche group of patients who are willing to pay for that. But at the end of the day, as a private healthcare organization, for us it's, every time we talk about the medical industry, we are always seen as making profits. And with all the insurance issue and so on, this is a very hot topic today. But what people don't see would be the cost of running these hospitals. Whether patients come in or not, we need to run the OT 24 hours. We need to ensure a steady stream of energy consumption within the hospitals. So a lot of issues that we can debate about, but at the end of the day, the quality services that we give our patients need to reach the people who really need it. So that is why, for example, in KPJ's case, you don't just see KPJ hospitals in Selangor, Damansara, Rawang, Johor, Penang, the highly populated areas. We opened our 30th hospital just a few months ago in Kuala Selangor. Why? Going back to the social element. But people in Kuala Selangor, if they want to go to a private hospital, they have to come all the way to Klang and Shah Alam. So today we opened the first private hospital in Kuala Selangor. So the purpose of doing this is to ensure that a growing community in Kuala Selangor is able to have access to quality healthcare services, right? And it also goes back to the different specialties that they have access to. So very quickly, just to share with you how this whole KPJ health system works and how it addresses the social equity element in the healthcare industry. So we have this motto called we heal, we teach, we discover. We heal through our clinical initiatives. We teach through our education. I'm not sure how many of you know that KPJ, we don't just run hospitals, we also have KPJ University in Nilai and in Penang. So even in these universities, we need to embed sustainability. I'm so glad to hear from my friends here today that we have a center of planetary health at UTM, am I right? So what do you call it? Center of Environmental Sustainability, exactly. So this is a great initiative by an academic institution to address sustainability issues. And I'm not sure if you're familiar with this, Prof. Just last year, in December, during COP29, NUS, for example, started off the first Masters in Sustainable Healthcare. First Masters in the world, Masters in Sustainable Healthcare. And they've also introduced executive education for sustainable healthcare. So this is not just sustainability, but they're going one step further to look at sustainability within the healthcare industry. So why I'm stressing about this under the social element is because we need to equip our workforce, we need to equip our people with the right training and right competencies and right awareness about sustainability. So the KPJU that we are running is already including elements of sustainability in all their medical courses. And finally, when it comes to research, we discover, right? So we're not just running a hospital organization, not just an education arm, but we also need to look at how we are able to run strategic research that improves the patient care or healthcare delivery. So that is why when it comes to the private sector, the way we work together with the academic institution goes a long way in how we can address the pain points in the private industry and how the researchers in the academic institutions can solve this problem. And this is not just healthcare. In every industry that all of you are in today. I was from the power sector before I came to the healthcare industry. Same thing. When it comes to installing rooftop solar panels or having large-scale solar farms, the researchers or our friends in the academic institutions, they are saying, I have all the students, I have all the research grants, but sometimes what we lack would be the pain points from the industry that we want to solve. So here is where that collaboration, multi-collaboration between the private sector and academic institutions will go a long way in institutionalizing the social element in sustainability. Now, finally, I just want to quickly share with you how is it that a healthcare organization like KPJ, how do we carry out CSR activities? Because at the end of the day, and also for all the companies that are present here, you may have a certain budget every year. So it's not just about okay, I spend a certain amount of money for my CSR. You need to know the number of people you are impacting. How does it improve the socio-economic conditions of the communities you live in? And how do you measure this? There's a term called SROI, Social Return on Investment, which measures for every 1 ringgit you spend for your CSR activities, what is the enhanced value? So that will take another 1 to 2 hours. Let's not get into that. But the point here is there are metrics and indicators that companies can use to justify to your board, to your management, to say that this CSR activities is not just about enhancing your reputation, it's not just helping the people around you, but it also has a strategic meaning and also the accountability to your environmental and social responsibility. And that's what we're trying to do. So for us, for example, we carried out this We Care campaign with the deaf community. This is very recent. But you know what we are very, very proud of? Our mobile clinic service. I'm not sure how many of you have heard about KPJ Healthcare's Kwan, Clinic Wakaf Anur. So we work together with Yayasan Anur from Johor, under Jacob. Our parent is Jacob, our parent company. Our shareholder is Jacob. So we work together with Yayasan Jacob to have these mobile clinics. So what do these mobile clinics do? These mobile clinics go to the rural areas and give them free healthcare services, dialysis centers, and so on. So here, as we are able to utilize the best of our business to help the local communities, the people who can't afford it. Just recently, just after Ramadan month, during Raya, we had an event in Chowkit. So if you know the Chowkit area, a lot of people are struggling there, and they do not have proper access to healthcare. So we bring in our mobile clinics to Chowkit twice a week to give them free services. And we send in our doctors, and this is also an opportunity for our doctors within our hospitals to participate in activities that give back to the communities, right? So we've launched this clinic, Wakaf Anur, in many areas, especially in rural areas in Sabah, in Pahang, Kuantan, of course, within the Klang Valley and so on. And we are expanding this, right? Since its establishment in 1998, we have impacted almost 2 million people, right? And we've spent about 15 million yearly on CSR activities to carry out activities like this. So the reason I'm sharing this is to to share this effort that we are able to utilize the expertise of the businesses that we operate in to ensure that our local communities are able to benefit the most. And another community outreach or community engagement that we carried out was for the Orang Asli community, where was our hospital, KPJ Pasir Gudang. We brought in doctors from there to go to Kampong Peta, which is at the Endau Rompin National Park. Again, this is providing quality access to healthcare for those who need it, right? So all these CSR activities, the next question is, as I mentioned earlier, how do you measure it, right? Which brings to my last slide. I won't bore you anymore with this, but very quickly, just to share with you. We've spoken a lot about the social equity, but it's important to measure, because at the end of the day, if you're not able to measure what you're doing, it becomes meaningless and pointless, right? This is not just for reporting purposes, because as a listed company, obviously we are required by Bursa to report all our economic, performance indicators, but it's also to show the value that we are enhancing from every activity that we are carrying out. So all the indicators that you see here goes back to the workforce, it goes back to increasing mental health, it goes back to enhancing training for our workforce and so on. But I also want to touch a bit on CSR activities. So I mentioned earlier, one of the key indicators would be SROI. We can also measure the number of people you're impacting through your activities. For example, for KPJ Healthcare, one of the indicators that we look at is how do we have early detection of illnesses through the activities that we are carrying out. How do we reduce healthcare costs for the people because of the initiatives that we are carrying out? So once you have all these indicators, you're able to put a value to it. So every dollar that you spend on CSR, you're able to see the enhanced value, not just for the people whom you're helping, but also for the organization. So, ladies and gentlemen, I think that brings me to the end of my presentation today on social equity. So the whole idea here is that when it comes to the social element of ESG, it's something that not just organizations are looking at it, it's also the investment community, our shareholders, the funds, analysts. A lot of these global institutional investors are pivoting towards the social impact. It's not just the environmental impact. Because when you talk about ESG, everyone's talking about climate change. I know it's been very hot the last few days or not weeks. It's been more than 40 degrees. All this is climate change. It's not just suddenly, everything is getting hot. You have to turn on your aircon more and you have to pay higher electricity bills. No, this is all impact of climate change. So most of the time we're talking about the environmental impact. We end up neglecting the social impact. So I hope this presentation would help to provide a little bit more insight on how KPJ Healthcare is addressing our social responsibility. Thank you.